I do think that very often when we think about ethics and privacy, we're mostly concerned about making sure that we are not collecting data and using data from people when they haven't consented to it. But especially in academic health centers, we are in a learning health system. I think that everything we do, we have to learn from it. We have to collect the data and use the data to improve care. So I think that patients who come through our doors have really good reasons to believe that we actually are tracking things and using that data to learn from it. And so when I think about ethics and data privacy, we really have to look at much broader ways of thinking about how do we responsibly and responsively collect and use our data. So we have to know what exactly would the purpose be. And then I think sometimes our communication, and this is going back to my marketing piece, is that our communication is not clear in terms of what exactly are the goals of collecting the information. Why do we think that this information will be important in achieving that goal? And so if we can be clear about those purposes and that those purposes really align with people's own priorities, then I think that we could be more trustworthy. And so that people would be more willing to share the data if they think that we will be holding the data, of course, in responsible ways and using them in responsible ways.
Yes.
So I think that when we talk about using data and we don't really know who actually gets to benefit, then that makes it harder as well, right? So why should some people donate their information or share their information when they have historically been excluded from the benefit, whether it's research or even just general access to care?
Yeah, you brought that up during your talk, and I thought it was fascinating. And also because sometimes I can imagine researchers aren't sure how they would use the data till they get more perspective and roll up their sleeves with it. So they might consider other uses once they start to analyze and interpret it.
Yeah, and I think especially in the age of big data now, right? We keep hearing that sometimes that we may have collected the data for one purpose, and we are even using it exactly for those purposes. But with big data, you may have data sets that can now be also shared with other data sets or merged with other data sets that can give us further insight, right? So when we think about precision medicine, is exactly how can we learn from different data streams. And so this is why I think that often when we talk about just like one research project or one product, one algorithm, would be kind of an impoverished way of thinking about it. So that's why I think having good governance structure and people who can understand and also trust the governance structure would be important. So it's not just about this particular research study. Often we trust those researchers because they might be recommended by our clinical team, but your data may go farther. And so unless people actually trust that whole governance structure of who would be the gatekeeper of the data sets and who can be the ones to give authority to use the data sets in appropriate ways, would help people to really decide whether they can give more broader consent, which is now more of the trend as well.
Just reflecting on my history with marketing and privacy, there's some ambivalence too when you ask too many questions that people become concerned that they're giving something up that's valuable and they want to be compensated. They become nervous because it is valuable. What do you say to that? The possibility that you might limit the amount of data you get by asking too many questions or communicating too much about it.
Yeah, I was actually, this is really fascinating because I might have mentioned this at my talk as well. We just finished a project on cluster trial ethics and the use of data, especially in cluster trials that may be more about health service delivery. So not necessarily using like individually identifiable data. Should we still seek consent from individual people whose data may become then part of this data set? And one of our patient advisors mentioned about how exactly that was sometimes, when we ask for consent for all these different things, that people may get even more paranoid because they may have thought, well, this seems like pretty innocuous purpose. So sure, why not? But when you keep asking me, and when you ask me to sign this and that, then I keep thinking that there may be other nefarious purposes. So now I don't want to be part of this. So again, I do think that sometimes asking for permissions too many times and having very elaborate documents don't necessarily help people to understand the purpose of collecting data. And also at the same time, we also want to ask broader social questions in terms of what some people have called like a collaborative necessity. It really is when people are willing to contribute their data, that they can all benefit and that we can all benefit together. And so, yeah, so I certainly agree with you that sometimes when we ask too many questions, when we ask too many permissions, even we may actually inadvertently scare people off without helping them to understand
Yes.
what the purpose is.
And I'll tell you, I've seen a disconnect at UC between my marketing mindset, which is all about exposure, impressions, engagement, and then privacy. So I try to find that sweet spot so that we can move forward on any initiative. You don't want to bother people. You don't want to put them at risk, for sure. But you want to advance and get information so that you can serve those very same audiences. That's how I look at it. So I'd really be curious how the ethicist would see this. So an example is we have a newsletter that goes to 10,000 tech employees. And the idea when we started was that we're not to know anything about these audiences because they want their information private. So I would blindly send the emails out, but we didn't even know if people were clicking and how many were clicking. And from a marketing standpoint, that's like not being sensitive to your customer. So I talked with privacy, and they said, as long as I didn't drill down and spend time understanding who clicked what and that type of thing, I was welcome to go ahead and start analyzing my open rates and click-through rates, and then being responsive to a customer, which is so normal for a marketer, right? So it's interesting to be in between those worlds where you want people to be anonymous, but you also want to be responsive. And I use the analogy of like a trade floor. If I'm at a booth on a trade floor, I can see who's walking by, and I get a lot of information about that.
Right.
But online, you don't see a thing unless you open it up, right? In a way where now you have data.
Yeah, and then sometimes you would like to, as a marketer or even as researchers, you would like to understand a little bit more of the context of people who do click versus people who don't click, right? If they click because they don't have time versus this is not of interest to them, versus they don't trust where the data may be going, that could be very different. And so it may require us to have different outreach methods as well, right? And so I think often people think about marketing as we're just trying to persuade people to do things that they otherwise wouldn't do, right? When I do think that even public health communication is marketing, right? So
absolutely,
people have to be able to accept your messaging and to trust it and to motivate them to get the flu shot, COVID vaccine.
Yeah. That's how I've seen it. I started my career in public health. I was at Stanford and studied health communications and did a lot of public health work, and got so intrigued by consumer products companies because I thought, look at these companies really shaping almost negative behaviors that we're up against, like smoking and fast food and that type of thing. And I'd grown up in Japan and just could see it growing up. Like I could see McDonald's coming in and the shape of people and the health, like the profile changed before my eyes. And I had this pivotal moment with my profs at Stanford. I said, I want to go to Japan and work on heart disease. They said, heart disease is not a big deal in Japan. And I just, even as a young kid, I kind of saw it was changing. I didn't know from a heart disease standpoint, but you could see physiologically obesity start to creep in. So I did go there and work in medical product sales and worked on heart disease prevention. But when I could, as soon as I got my MBA, I went off and joined Procter and Gamble and as daughter, so that I could really be in those companies that I saw were so good at changing behavior. So I see that like public health and marketing are so allied. And of course, most people are really into selling their product. I'm sure they believe that what they're doing isn't bad. But I think if you have the right mentality and you're sharp, you can use marketing for good.
Yeah.
There's a big opportunity to do so in healthcare.
Right, because that's basically what health promotion campaigns are too, right?
Mhm.
And so that you're trying to see how you can motivate people to act in certain kinds of ways. And my concern is, generally speaking, one, how would the data be collected and used, right? And would it be really then more as a motivating factor rather than, some people may feel that they can be penalized when they're being tracked, right? So and then the other one is whether these campaigns or these marketing messages in the end may also stigmatize people who may not be able to engage in those activities because of many other kinds of social determinants of health, right? So
Yes.
it was interesting that a few months ago, I was attending a talk about the 10,000 steps.
Mhm.
And it was quite interesting because the speaker was really talking about how this can motivate people to move and so on and so forth, and what were different things that they could actually get people there, and which I thought were really important. And but at the same time, I thought, well, but many of these um, tactics or strategies really are not looking at the environment, the social environment. So people who are living in places that may have more gun violence, have less sidewalks and no parks and so on. Just giving them, a tracker is not going to by itself change the environment where people can actually live in a much more active and healthy way. And so, but then they now may feel worse about themselves because they didn't get to do the 10,000 steps or whatever that may be. And so how do we combine those things together? You can still promote those activities, but at the same time, recognize that there are many other social barriers that make it impossible or very difficult, so that these messages don't re-stigmatize people who have already had a hard time with activities.
Yeah. So where are you headed next? I'm going to read your book, which came out not so long ago, and I'm looking forward to that.
Oh, thank you.
Area of focus for you now.
So in relation to AI ethics,
Sure. Yes.
well, so I want to look at one type of product I want to look at more is on mental health, because chatbots are, I might have mentioned it the other day too, that like chatbots are now becoming more and more popular, and many companies are integrating them into consumer products. I mean, on the one hand, so I want to do a more ethical analysis to see, it's not that I think that we shouldn't have these products, but what would technologists really need to do in order to have these products or these services that can really help people with mental health? Because on the one hand, behavioral mental health issues are so stigmatized that many people don't want to seek in-person care, which of course to me speaks more about problems in the system than anything else. But at the same time, that having access to these technologies that you can use at any point would be one, perhaps a comforting thing, but at the same time may in some ways also reinforce some of the behaviors that we're trying to avoid in the first place, or behaviors around addiction and boundary crossing and so on. So how do we develop these applications, particularly now with generative AI, so that people can really use it with more confidence, but it really it's suiting the purpose and the right kind of purpose, because otherwise you can imagine consumer technology companies want more engagement, but some of the engagement is part of the problem.
Yes, yes. Interesting. Are you familiar with Adam Gazelli's project with the ADHD testing and rehab that they developed out of UC called not Viz AI. Adam Gazelli, he developed ADHD testing and treatment out of a video game product. And people were arguing that the video game could induce more ADHD among the customers. So just that very issue you're talking about. And I think he worked very hard with the tech transfer office at UCSF to address all concerns and get FDA approval. But very interesting product and set of questions, like could the technology kind of be a part of the problem, right?
Yeah, and those are, ethical but also empirical questions, right? And so I don't want to say for sure that it will be a problem until we have, field tested them, right? Because, mental health bots, and some of these companion animals, the robotic animals, were also to provide comfort and companionship for people to hopefully help them to be less lonely. Uh,
Yes.
but I do have that question, which is an empirical question. Some
Mhm.
people think it's more existential as well. Whether in some way, some of these technologies, if people think that they are replacing the human contact, that it may at the same time also make people even more isolated than before.
Right. Yeah. Okay. So that is so interesting. Well, um, yeah, that's just the announcement of that company and bringing up like, kids might need more social interaction to treat and similar set of questions. Well, I would love to continue this conversation with marketing and using marketing for good. Yeah, just how can it be used? And in the meantime, to put my money where my mouth is and support some of the good work you're doing so you get visibility here at UC or among whatever audiences. So I would like to help you and your work. And this is a top topic.
Mhm,
Data and
mhm,
how it's used is just one of the key concerns of the tech community.
mhm.
So at least in this very community, I'd like to support you and then
Thank
uh,
you. Thank you.
see what else we can do together. Are you in San Francisco?
I'm currently in Santa Rosa.
Okay, all right, okay.
I-
I'm in San Francisco,
back-
but when it's close enough, and November 8th, you'll 7th or 8th, and now I'm losing
I
track. I
think
think
it's the 7th. Yeah. I
7th.
haven't figured out whether I'm doing it online or in person.
Okay, okay. But hopefully we can get together the next time and then
Oh.
continue the conversation because I think there is so many interesting angles on this.
Mhm.
Me, I guess as a marketer, I think big, but I think because I was trained in public health, I'm also just try to be ethical, work
Yeah.
with privacy. I'm at UC, so in a
Mm.
way, I'm happily constrained by that challenge, right? And at one point, I'll have to tell you an interesting story where I was working with privacy and marketing a clinic, and I ended up doing really well.
Mhm.
People
Mhm.
were shocked because I was a bit aggressive, right? But privacy said, is this going to be education or marketing? And I said, it's education. We were training about the impact of osteoporosis training, testing and how important it is for our patients. Let's
Right.
say that was one of many examples. But
Right.
it's interesting to have to walk the line between privacy, getting the word out, ethical concerns. And I
Yeah.
enjoy those challenges. Like
Yeah.
you
Yeah.
can
And
without.
even though I also think it's a false dichotomy, right? I mean, everything we do, like even when we think about UC, we have to do fundraising. I mean, when we have grant applications, it's all marketing, right? I mean, marketing in the
Right.
sense, well, you need to sell your idea. So it's not a bad thing.
Yeah, exactly. And luckily the people around UC are very entrepreneurial for that reason. They're very,
Mhm.
I find them refreshing, not only because of their scientific training, but probably because they have to what they call eat what they kill.
I know. I know.
But is there anything I can do to help you or, you know,
Well,
just
I think this is helpful already, and so I hope that we can have further conversations, and if there's anything that's coming up that you think I can be contributing to or be a thought partner, you know, you have my email, so
I
uh,
will. I'm just starting to think about this. But I will keep in touch. And let's say at least by
sure.
November, we'll somehow touch base
Okay.
at that point as well. And I'll be reading your book between now and then.
Oh, thank you. It might be very philosophical in various parts too. So, so
Curious to read it. Thank you
oh,
so much.
thank
Okay,
you. All right,
well,
bye
thank
for
you.
now.
Wait, last question. But
Yes.
how often do you go back to Hong Kong? And like just
Oh, I'm going actually next month just because my mom lives there.
oh great. Okay. Oh, that is so neat.
She couldn't figure out how to set her alarm the other day. She asked me to call her at 6:30 a.m. her time. So I was like, okay, that's 3:30 my time here. And so when we talk about technology, and elderly, I was like, oh,
You got to go back and do it. And then
autonomy.
okay, and she didn't, and you came out by yourself. And finally, what do you find most meaningful about your work right now? Like just in a word, I always love just hearing like what drives you, or what do you find?
Well, people talk about future proofing. I don't think we're future proofing. I'm not sure I have one word, but it's just really looking it, to me, it's like a hopeful future. And when we integrate ethical considerations into big ideas and innovations, I think it can really help us to, you talked about marketing for good, how to think about technologies for good, but for good for everybody, right? And so I actually feel quite hopeful in many ways.
Right. Okay, good. Thank you. I love hearing that. That puts my weekend off to a great start.
Thank
Good.
you. All right, talk to you later. Have
Back
a
to you.
great weekend. Okay,
Bye bye.
bye-bye.